Waking up multiple times at night to use the bathroom is a common struggle for diabetics. But what if certain vitamins could help reduce this? Studies show that specific vitamins support kidney health, regulate fluid balance, and improve blood sugar control, all factors that can reduce nighttime urination. Did you know that vitamin deficiencies can contribute to increased urination at night? In this video, we'll uncover which vitamins can help manage this issue and share simple ways to include them in your daily routine. Could these vitamins be the solution you've been looking for to improve your sleep and overall health? Let's find out. 1. Vitamin B6. Vitamin B6 plays a key role in supporting nerve health, which is especially important for individuals with diabetes. It helps in the production of neurotransmitters that transmit signals between nerves and muscles, including those that control the bladder. In diabetics, prolonged high blood sugar can damage peripheral nerves, a condition known as diabetic neuropathy. When this affects the nerves involved in bladder control, it can lead to issues like frequent urination, urgency, or incontinence, particularly at night. Adequate levels of vitamin B6 help maintain the integrity and function of these nerves, reducing the risk of such complications. Vitamin B6 also helps regulate blood sugar levels through its involvement in glucose metabolism. It assists enzymes in breaking down glycogen, the stored form of glucose, allowing the body to access energy more efficiently. A deficiency in vitamin B6 may worsen insulin resistance and impair glucose tolerance, making it harder for diabetics to maintain stable blood sugar levels. Some studies suggest that supplementing with vitamin B6 can improve glucose metabolism and reduce complications associated with poor blood sugar control, especially when combined with other B vitamins. In one clinical trial, diabetic patients who received 50 milligrams of vitamin B6 daily for 12 weeks showed improved insulin sensitivity. Another study found that low plasma B6 levels were significantly associated with higher HbA1c values in type 2 diabetics. Research has also shown that vitamin B6 deficiency is more prevalent in diabetics with urinary symptoms, linking it to poor nerve control of the bladder. The link between vitamin B6 and kidney function is also notable. Vitamin B6 plays a protective role in kidney health by supporting proper amino acid metabolism and reducing the accumulation of toxic byproducts. In people with diabetes who are already at increased risk of kidney damage, low levels of B6 may worsen inflammation and accelerate the progression of kidney disease. Since the kidneys are responsible for filtering waste and excess fluids, any decline in their function can result in more frequent urination, including at night. Ensuring adequate B6 intake may help support kidney function and reduce urinary frequency by lowering the strain on the kidneys. Vitamin B6 is also involved in the production of serotonin, a neurotransmitter that helps regulate mood and sleep cycles. Poor sleep is a common issue among diabetics, especially those experiencing nocturia. Low serotonin levels may contribute to restless sleep and increased nighttime awakenings. By supporting serotonin production, vitamin B6 may indirectly help improve sleep quality and reduce the impact of nighttime urination on overall well-being. It also helps reduce inflammation, which is often elevated in diabetics and contributes to multiple complications, including those affecting the urinary tract. For people with diabetes, maintaining sufficient levels of vitamin B6 is essential to support nerve function, blood sugar control, and kidney health. A deficiency in this vitamin can contribute to worsening neuropathy, poor bladder control, and increased urination at night. Regular intake of vitamin B6, along with other supportive nutrients, can reduce the risk of long-term complications and improve quality of life in diabetics. To correct a deficiency, the general recommended dietary intake of vitamin B6 for adults ranges from 1.3 to 2 milligrams per day, but higher doses may be needed for therapeutic purposes in diabetics. In clinical use, doses of 25 to 100 milligrams per day are often prescribed under supervision, especially for treating neuropathy and improving bladder nerve function. Improvements in nerve function and blood sugar regulation may begin to appear within 4 to 8 weeks of consistent supplementation, though changes in urinary frequency may take up to 2 to 3 months, depending on the severity of the deficiency and underlying nerve damage. 2. Vitamin D. Vitamin D plays a critical role in regulating insulin function and sensitivity, which is essential for blood sugar control. When vitamin D levels are optimal, insulin functions more effectively, helping to regulate glucose metabolism. Low levels of vitamin D are commonly seen in individuals with type 2 diabetes, and this deficiency can lead to insulin resistance, making it harder for the body to manage blood sugar. Some studies suggest that vitamin D can enhance the body's ability to respond to insulin and may even help prevent the development of type 2 diabetes in those at risk. The connection between vitamin D and bladder health has also been recognized. Vitamin D receptors are found in the bladder, and these receptors help maintain proper bladder function. Low vitamin D levels can affect the bladder muscles, impairing their ability to control urination. This may lead to increased frequency and urgency of urination, including at night. Furthermore, vitamin D plays a role in the regulation of vasopressin, a hormone that controls water retention in the body. When vitamin D is deficient, vasopressin may not function as effectively, causing the kidneys to produce more urine, particularly during the night. In one study involving over 400 older adults, those with low vitamin D levels were more likely to report nocturia, confirming its potential link to nighttime urinary issues. Vitamin D is also involved in several biochemical processes that directly impact glucose metabolism. Studies have shown that vitamin D influences the function of pancreatic beta cells, which are responsible for insulin production. When vitamin D levels are low, these cells may become less effective at producing insulin, leading to higher blood sugar levels. Additionally, vitamin D can modulate the activity of certain enzymes and hormones that help control glucose metabolism, such as the enzyme that converts inactive vitamin D into its active form. This active form of vitamin D, known as calcitriol, is vital for maintaining the balance between insulin secretion and glucose absorption in tissues. When vitamin D levels are insufficient, this balance is disrupted, which can exacerbate the challenges diabetics face in managing their blood sugar. The impact of vitamin D on kidney function goes beyond just fluid regulation. Vitamin D deficiency has been linked to an increased risk of kidney disease, which is a common complication in diabetics. When kidney function deteriorates, the body struggles to remove waste products and excess fluids, leading to fluid retention and increased urinary output. Additionally, vitamin D deficiency has been shown to contribute to an imbalance in the renin-angiotensin-aldosterone system, RAS, which regulates blood pressure and fluid balance. Disruption in this system can further impair kidney function and lead to frequent urination, particularly at night. Restoring vitamin D levels can help correct this imbalance, potentially improving both kidney and bladder function. Furthermore, improving vitamin D status has been associated with better outcomes in people with diabetic nephropathy, a form of kidney damage common in diabetics. A study found that vitamin D supplementation significantly slowed kidney function decline in patients with early diabetic nephropathy. To address vitamin D deficiency, a daily intake of 600 to 800 international units is recommended for general health. For individuals with diabetes or severe deficiency, higher doses of 1,000 to 2,000 IU may be beneficial. In cases of significant deficiency, 50,000 international units per week for a short period, 6 to 8 weeks, may be prescribed, followed by a maintenance dose. It typically takes 4 to 6 weeks of supplementation to see improvements in vitamin D levels and their effects on blood sugar regulation and urinary function. However, noticeable changes in nighttime urination might take up to 2 to 3 months. 3. Vitamin A. Vitamin A plays a vital role in supporting pancreatic function, especially the beta cells responsible for insulin production. In diabetes, these cells often become damaged or dysfunctional. Vitamin A helps maintain the structural integrity and performance of these insulin-producing cells, promoting steadier blood glucose levels. When insulin is produced and used efficiently, it reduces the excessive filtering burden placed on the kidneys, which in turn helps minimize excess urination, particularly at night. This vitamin also has a protective effect on the urinary system. It helps maintain the epithelial lining of the bladder and urethra, creating a strong barrier against irritation and infection, both common causes of nighttime urination in diabetics. Vitamin A helps maintain mucous membranes that line the urinary tract, reducing inflammation and supporting healthier fluid regulation. Individuals with low vitamin A levels are more likely to experience urinary discomfort and frequent urges, especially during sleep hours. Vitamin A contributes to antioxidant defense, helping the body neutralize free radicals that damage tissues, including those in the kidneys and bladder. Oxidative damage is a major factor in the progression of diabetic complications. By lowering this damage, vitamin A helps preserve kidney filtration and bladder control. In one observational study, participants with higher vitamin A intake showed lower rates of kidney dysfunction and better fluid retention overnight, reducing the risk of waking due to bladder pressure. Additionally, vitamin A plays a role in immune balance, which is essential for preventing recurrent urinary tract infections, a common issue among diabetics that worsens nocturia. It enhances the body's ability to fight off pathogens while calming chronic low-grade inflammation that disrupts bladder function. This dual action supports restful sleep by decreasing bladder sensitivity and nighttime urgency. Vitamin A also influences hormone signaling related to water balance in the body. Retinoic acid, the active form of vitamin A, affects the expression of genes that regulate kidney reabsorption of water. When vitamin A levels are low, this process can be impaired, leading to increased nighttime urine production. Maintaining sufficient vitamin A can help normalize this hormonal balance and reduce nocturnal urinary frequency. For adults, the recommended daily intake is 700 micrograms for women and 900 micrograms for men, measured in retinol activity equivalents, RAE. In therapeutic settings, slightly higher doses may be used under medical supervision. Positive changes in blood sugar regulation and urinary frequency are generally seen within 6 to 8 weeks, although benefits for kidney and bladder tissues may take up to 3 months to fully develop. When used appropriately, vitamin A can support not just vision and skin, but also deeper functions tied to glucose balance and bladder control, making it a helpful nutrient for people with diabetes managing nighttime urination. 4. Vitamin C. Vitamin C plays a significant role in maintaining vascular health, which is often compromised in individuals with diabetes. Elevated blood sugar can damage the inner lining of blood vessels, making it harder for oxygen and nutrients to reach tissues, including those in the kidneys and bladder. Vitamin C supports the repair and function of these blood vessels by promoting collagen synthesis and reducing oxidative injury. This not only preserves overall kidney performance, but also aids in regulating fluid excretion, which can help limit nighttime urination. Beyond vascular support, vitamin C also helps lower inflammation and oxidative stress, two major contributors to diabetes-related complications. Chronic inflammation affects insulin signaling and can disrupt normal urinary patterns. By reducing pro-inflammatory markers, vitamin C may improve both insulin action and bladder muscle tone. Clinical research has shown that individuals with higher intake of vitamin C experience a drop in fasting glucose and oxidative damage, both of which play a role in overactive bladder function. In one study, patients receiving 1,000 milligrams of vitamin C daily for 6 weeks saw measurable improvements in blood sugar stability and nighttime urinary frequency. Vitamin C also contributes to kidney filtration and immune regulation. Diabetics are prone to urinary tract infections, which can worsen nocturnal urination. Since vitamin C boosts immune defenses and slightly acidifies urine, it may help reduce bacterial growth in the urinary tract. This protective effect can ease bladder irritation and reduce urges during sleep. Moreover, vitamin C enhances nitric oxide availability, which helps maintain proper blood flow to the kidneys and supports their ability to concentrate urine. In terms of metabolism, vitamin C enhances the function of enzymes involved in carbohydrate processing. This can indirectly ease pressure on the pancreas and improve how the body responds to glucose spikes. Better glycemic control reduces glucose spilling into the urine, a common issue in poorly controlled diabetes that leads to polyuria, especially at night. In a randomized trial, daily vitamin C intake was linked with improved insulin sensitivity and reduced markers of oxidative damage, confirming its role in stabilizing both glucose levels and urinary output. For individuals managing type 2 diabetes, vitamin C can offer a dual benefit: better glucose handling and reduced bladder stress. When levels are low, tissues struggle to repair, inflammation rises, and the bladder becomes more sensitive. Supplementing with this vitamin may not only help improve energy and immunity, but also minimize disrupted sleep from frequent urination. The recommended daily allowance for vitamin C is 75 milligrams for women and 90 milligrams for men, though therapeutic doses for diabetics often range from 500 milligrams to 1,000 milligrams per day based on clinical needs. Most users start noticing results in 4 to 6 weeks, with clearer benefits for urinary health appearing after 2 to 3 months of consistent use. Since vitamin C is water-soluble, excess amounts are typically excreted, making it safer when taken within recommended limits. Individuals with diabetes should speak with a healthcare provider before starting vitamin C therapy, especially if they have kidney issues or are prone to kidney stones. With proper guidance, vitamin C can play a valuable role in supporting blood sugar control and easing nighttime urination. 5. Vitamin E. Vitamin E is a powerful antioxidant that plays a vital role in protecting cells from oxidative stress, a condition that is often elevated in individuals with diabetes. High blood sugar levels produce more free radicals, which can damage blood vessels, nerves, and organs. Vitamin E neutralizes these harmful molecules, helping to maintain the integrity of nerve tissues, including those involved in controlling bladder function. This protection is essential for preventing complications like diabetic neuropathy, which can impair the nerves regulating the bladder and increase nighttime urination. In addition to nerve protection, vitamin E also contributes to improved blood sugar balance. It helps stabilize cell membranes, allowing insulin receptors to function more efficiently. This supports better glucose uptake by cells and can improve overall metabolic health in people with diabetes. Studies have shown that vitamin E supplementation can enhance insulin sensitivity, particularly in those with type 2 diabetes. One clinical trial revealed that taking 400 IU of vitamin E daily for 3 months significantly lowered fasting glucose levels and improved HbA1c. Another study found that diabetics with higher blood levels of vitamin E had better glycemic control and fewer urinary symptoms, including nocturia. Vitamin E also plays a role in kidney health by reducing inflammation and slowing down the progression of kidney-related complications in diabetes. Inflammation in the kidneys can impair their ability to concentrate urine, leading to increased fluid loss during the night. By lowering inflammatory markers, vitamin E helps preserve kidney filtration capacity, which can directly reduce the frequency of nighttime urination. Furthermore, vitamin E has been shown to reduce proteinuria, a sign of kidney damage, in diabetic patients, suggesting it supports both kidney structure and function. Sleep disturbances caused by frequent urination are common among diabetics. Vitamin E helps promote restful sleep by calming the nervous system and reducing oxidative damage in the brain, which can influence sleep cycles. A healthier nervous system improves bladder control and reduces the likelihood of waking up multiple times during the night. Additionally, vitamin E helps regulate the balance of nitric oxide, which supports blood flow to organs, including the bladder and kidneys, further improving their function and reducing overactivity. For those managing diabetes, maintaining healthy levels of vitamin E is crucial not only for blood sugar control, but also for nerve and kidney support. A deficiency can accelerate the progression of neuropathy, increase oxidative stress, and impair bladder regulation, all of which contribute to frequent urination at night. Regular intake of vitamin E may help reduce these issues and promote better sleep and energy levels throughout the day. To support diabetic health, the general recommendation for vitamin E is 15 milligrams, 22.4 international units, per day from dietary sources. For therapeutic purposes, especially in managing oxidative stress and improving nerve function, doses between 200 and 800 IU per day have been used in clinical studies under medical supervision. Notable improvements in nerve health and blood sugar management typically begin to appear after 6 to 10 weeks, while benefits related to nighttime urination may take up to 2 to 3 months, depending on the severity of existing complications and how well the body responds. Before starting a vitamin E supplement, it is important for diabetics to consult a healthcare provider to avoid excessive intake, which could interfere with blood clotting. With the right approach, vitamin E can be a valuable nutrient in managing both blood sugar and nighttime urinary symptoms. Now let's talk about 5 meal ideas filled with these vitamins that support diabetic health and help to reduce nighttime urination. Grilled salmon is an excellent source of vitamin D, which supports proper kidney and bladder function. Grill a salmon fillet to perfection and pair it with roasted asparagus, known for its diuretic properties, in a fresh mixed green salad. This meal not only supports insulin sensitivity, but also helps reduce excessive nighttime urination by promoting healthy kidney function and fluid balance. Sweet potatoes, rich in vitamin A, help reduce inflammation and improve kidney function. Bake a sweet potato and serve it with steamed Brussels sprouts, a fiber-rich vegetable that supports digestion and reduces fluid retention. Adding grilled chicken breast for lean protein helps stabilize blood sugar levels, while the combination of ingredients assists in maintaining proper fluid balance and minimizing nighttime urination. Citrus fruits like lemon and orange, packed with vitamin C, help maintain blood vessel health and reduce inflammation. Prepare a citrusy chicken salad, topped with creamy avocado and hydrating cucumber. The vitamin C content supports healthy kidney function, while the hydrating properties of cucumber can help manage fluid retention and minimize the urge to urinate during the night. Vitamin E, found abundantly in avocados, supports kidney health and reduces oxidative stress. Blend a smoothie with avocado, spinach, and flax seeds for added fiber and anti-inflammatory benefits. This meal helps regulate fluid balance and reduces kidney strain, preventing the overproduction of urine that often leads to nighttime urination in diabetics. Vitamin B6 helps regulate fluid balance and is essential for nerve health. Cook a hearty red rice and lentil stew, known for its high fiber content, and serve it with roasted turkey. This meal supports blood sugar regulation while also enhancing kidney function and reducing fluid retention, both of which can help minimize nighttime urination. With a few simple adjustments to your routine, you could enjoy better sleep and improved overall health.